As a clinical social worker in the NICU, I use CaringBridge as a therapeutic tool for families. They're able to go in and do a daily journal, also receive feedback from family and friends through their different postings. I also encourage families to print out the website and use it as a way to reflect back on how far they've come on their journey.
As social workers, one of the things that we want to do kind of quickly is to help the families mobilize their own support system. And for families that are out of town or often out of state, it's pretty hard to do that by phone. So a quick way to do that is to refer them to CaringBridge to get the information out quickly, and then they could just make a call to one family member and have that family member refer everybody else to it to get information. And it's also nice too because families can feel support pretty quickly by reading the journal entries that come and find that very encouraging.
Two primary pieces of feedback that I hear from families who are using the resource is that it lets you get information out to people about your situation without that telephone tag effect, so that anyone who's looking at it is hearing the same information instead of it going through multiple people. The other thing is that it really allows you to access support through the guest book function without needing to spend a lot of time on the telephone, or also having to hear yourself tell the story over and over, because families will usually talk about reaching a point where they just don't want to tell that story again.
There's a lot that we can do as social workers to support family, like making sure they have a place to stay in the evenings, making sure they have food, do short, brief counseling or other things like that. But I think the best support that they get are often from people in their family or their own social support network. And CaringBridge offers a nice way for them to connect with those people that they may not be able to call on the phone, or oftentimes families don't want a lot of calls into the room because it's busy and it's hard to get to a phone, and they're just wanting to limit the amount of contact that way. And CaringBridge is a nice way to kind of reduce the family stress by having families just go to, when they want to the website and look at what people have posted for them. So it just kind of lifts them up at a time when they are pretty down in the dumps and not knowing what the next day or even the next hour holds for them. So it really has spoken to them in their time of crisis.
Families have, through and through, been very, very pleased. And also, I think some families initially are a little bit, if they haven't had much computer time, they're a little worried about whether or not it'll be something that's user-friendly. And I can also tell them there that other families who have never used a computer have said it's really a very easy process, walks you through how to do it. And then again, once they've done it, they'll come back and say, oh, that's great, I wish I was doing it right away.
It's a very easy thing for families to do. I've never had a family come back and say, you referred me to go create a website and it was hard and I couldn't figure it out. Also, I think it's very cathartic for families. We will often tell families when they're struggling through difficult times in the intensive care unit, maybe write down some of your feelings or do some journaling. Some families aren't really feeling like they want to do that or can't focus, but I think CaringBridge puts it in a nice format to where they can tell their hospital experience in a narrative form, and it's kind of cathartic. They're letting those emotions out. They're letting them out in the way that they want to.
It's been such a wonderful resource for them, again, to be able to tell their story and also to receive report. A lot of times you'll hear families go over to the Resource Center, print off all of the guest book messages that they've gotten, and then sit with their child and read through all of them and just feel a wonderful sense of support.
I worked with a premature baby who was 24 weeks, and she was in our unit for about 6 months, and her family had a CaringBridge website, and she transferred to another state to have a transplant surgery done. And CaringBridge has been a great way for our NICU staff to keep in touch with the family and to support the family. We get to see pictures of her and how she's done and read about her progress. So without CaringBridge, we wouldn't be able to do that.